Good day, ma'am. I am Baisiti Warda Panday, and today I am going to demonstrate the procedure on the prenatal care and the Leopolds maneuver. So first, the equipment is a tape measure, the mother and baby book, the tetanus toxoid vaccine, and a 3 cc syringe. So the procedure number 1 is to identify the client and explain the procedure. Rationale is to prevent the errors, and this enhances the client to be cooperative and fan his confidence. Good day, ma'am. I am a student nurse from the Notre Dame of Tacorong College. So, ano pong pangalan niyo, ma'am?
Sulema po.
So, ngayon po is magpo-perform po ako ng Leopolds maneuver para po ma-detect natin kung ano po yung position ni baby and para malaman yung fetal heart tone. Is that okay po?
Yes po.
Sige po, thank you. Then, next is to assess the client's health history, which includes the personal, family, social, and previous obstetrical and presence obstetrical data. So, rationale, information gathered by the healthcare provider will help to establish baseline data, identify teaching needs. Next is to assess the client's knowledge on guidelines for health and pregnant and antepartal care. Rationale, to provide a baseline data to identify the teaching needs and serves as a baseline data for succeeding prenatal care. Next is review the plans for antepartal care visits, examination, and laboratory findings. Rationale, to serves as a baseline data for a succeeding prenatal care. Next is to monitor the vital signs of the client. Rationale, to provide a baseline data or future comparison and identification of factors that may place the client at risk for the problem. So, ito-take ko po ang vital signs niya ngayon, ma'am.
Bakit pa rin balik ko?
over 80 po, ma'am.
Normal po yung nurse.
Opo. So, pause ko naman ito, ma'am.
Ano yan, nurse?
Para sa oximeter po, para... Normal naman po, ma'am. 95 po.
Okay po.
Next is measure the height on the initial visit and monitor the weight of in the succeeding visit. Rationale, weighing is an important part of each prenatal examination. A gain or a decrease in weight will affect pregnancy. Next is conduct conduct a physical examination. Begin assessing from head to toe. Rationale to come with the general impression of the woman's health and well-being. Next is perform the abdominal examination. First is instruct the client to empty or void her bladder to promote on the part of the client. So, ma'am, so ngayon po is mag-start na po ako mag-assess ng tiyan niyo. So, di po kayo makaihi?
Hindi po, ma'am.
Sige. Next is position the client in a dorsal recumbent. Dorsal recumbent, rationale, proper positioning relaxes both mother and the baby, and it also facilitates the easy location and presentation and lie of the baby. Then drape the client and expose the abdomen from the level of the xiphoid process down to the symphysis pubis. Rationale to provide privacy. So, ma'am, itaas ko lang po itong kama, ma'am, para mas maganda po yung pag-assess ko sa inyo. Next is measure the fundic height using a tape measure starting at 0 centimeter. 0 centimeter. Rationale to determine the gestation and growth of the fetus. So, the centimeter side of the tape measure must be facing the abdomen while the inch side is facing the examiner. Rationale to prevent bias. Then locate the highest point of the fundus. Leave one hand in place and secure the end of the tape measure to the fundus. Measure down to the top of the symphysis pubis. Rationale to measure the fundic height correctly. So, ma'am, i-measure ko po yung paano ko po laki yung siya niyo. Yung fundic height niyo. Is that okay? Ito. Ayan po. Then, document the procedure in centimeter. Rationale to compare with the calculated gestation. Then perform the Leopolds maneuver. Rationale to assess the condition and fetal presentation. First is warm the two hands by rubbing one against other before placing them on the abdomen. Rationale, the use of warm hands during the palpation prevents tension and hardening of the abdominal muscle and favoring a good result. So perform the 4 maneuver first during the first 3 maneuvers. So the examiner stands at the side of the client's bed and facing the client. Rationale to the position favors accurate performance of the maneuver. So the first maneuver is the pundal grip, which is with both hands palpate upper abdomen and fundus for first consistency. The head is round, hard, and breech. So next is the mobility. The head moves independently and breech is less mobile. Rationale to determine the fetal part lying in the fundus. Next is the second maneuver, which is the umbilical grip. With the both hands moving down, palpate the side of the uterus from the top to bottom. So the one side is smooth, hard resistance surface, which is it indicates the back, and on the other sides it is angular modulation, which is it indicates knees and elbow. Rationale to determine the fetal back for fetal heart tone. It usually found in the left lower quadrant. Next is the third maneuver, which is the pollex grip. So with the right hands over the symphysis, identify the presenting part by grasping the lower abdomen with the thumb and the fingers. So then assess whether the presenting part is engaged in the pelvis. If head is engaged, it will not move. It is soft. It is at the back. Rationale to determine the engagement of the presenting part. So the fourth maneuver is the pelvic grip. So the nurse alters position by turning towards the patient's feet. With both hands, assess the descent of the presenting part by locating the cephalic prominence of the brow. Then place your fingers on both sides of the uterus, about 2 inches above the inguinal ligament. Then press downward and inward. Then, if the fetal back is palpated, it meets no obstruction. Then the other hand will meet obstruction. The fetal brow is palpated. Rationale to determine the degree of flexion of the fetal head. This is the fourth maneuver. Then reposition the client. Rationale to make the client feel comfortable.
Okay na po, ma'am. So,
Next is administer the TT or the tetanus toxoid vaccine following the recommended schedule. The TT1 gives as early as possible. The TT2 is after a month later. TT3 at least 6 months later. 6 months later of the tetanus toxoid. Then TT4 is at least a year later. Then TT5 is about 1 year later after the TT4. Rationale is to prevent both the mother and the newborn from tetanus. And administer iron folate supplement until the 2nd month of the postpartum. Rationale to regain iron loss during the childbirth. Then administer malaria prophylaxis to all pregnant women in endemic areas as ordered by the doctor. Give 2 tablets of the chloroquine phosphate to 250 milligrams every week for the duration of the pregnancy. Rationale, women are most likely to develop malaria when pregnant. Malaria can cause miscarriage, premature labor, and small babies. Then provide and promote health teaching on good nutrition, personal hygiene, and enough rest and sleep. Rationale to ensure an optimum environment for health, growth, and development. Discuss with the client her expectations about pregnancy, which includes the danger signs of pregnancy, labor, delivery, and impact on the family. Rationale, the psychological assessment is important to assist the client in identifying areas of need to ensure the optimal level of growth and development. Plan with the mother the preparation for breastfeeding the baby. Rationale to know the advantage of breastfeeding to the newborn. Then discuss the importance of prenatal subsequent visit to rationale for follow-up care. So that's all, ma'am. Thank you.